So Lorraine, if there was one thing you would change to improve patient safety, what would it be?
It would be communication. I know it's a really broad issue, but I think it's really an important issue in the healthcare setting. You've got communication between providers and their patients. You've got communication between providers and other providers. You have communication between families and their providers. And they all play a very important role in delivering good healthcare and safe healthcare.
What do you think then is impeding strong communication among all these different parties?
First and foremost, I think it's important for providers to speak to other providers. So whether it's physician to physician, physician to nurse, physician to physical therapist, physician to, referral specialist, it's really important. And I think people tend to assume that because they documented something, that's communication. And we all know in the safety sense, documentation is not communication. Well, it's important to document conversations that you have, but it's also important to have the conversations first so that you can document them. It's just really, an important aspect of the care.
And so you had mentioned communication between the provider and the patient's caregivers as being another matter you'd want to focus on.
When a patient has an opportunity to ask you a question, you're really able to gauge, how they're understanding the materials. One of the reasons that was so important is because you understand what your patients are comprehending. So did the patient really understand what this condition was? Do they really understand that they're going to be on that medication for the rest of their lives? Do they understand that, there are potential consequences to, choosing to have one procedure done or choosing not to do a procedure? Do they understand what that procedure entails and what the possible consequences are? And just as important, the family has to be informed. So if you've got a family member that's with the patient, it really behooves you as a provider to find out what the relationship is, why that person is a trusted communicant.
Obviously, like we said at the very beginning, it's a very big issue, and so it must be very overwhelming to providers to find a way to communicate everything practically to everyone so clearly and as clearly as it needs to be.
It is a challenge because, you're human. And sometimes you just get tired. So, when you're seeing patients and it's 7:30 at night and you've been seeing patients since 7 o'clock in the morning, you kind of have to force yourself to make sure that person that you're seeing has the same opportunity to, have the good side of you as the person that saw you earlier in the day.
Obviously, one place that communication is a big focus is during patient transfer and patient discharge. Would you care to speak to that a little bit?
So one of the things that comes up as a provider is, you may get a communication from the hospital. Say a patient was seen in the ED and you're getting a discharge summary with that patient. The patient was told to come to your office within 24 to 48 hours after they've been seen in the ED, and now they're coming to your office. And you've got a beautiful electronic summary of their entire medical history, their family history, their social history, and the most important thing is not there. And what I'm referring to is there's no communication to that outside provider about why they sent you the patient to begin with. And so that communication is really important because it facilitates care and it's just best practices.